And let's move on. The 88-game NBA season returns July 30th. I'm sorry, guys. This already passed. Let me start that again. I forgot we're taping this show. We're taping today, but the show airs on Sunday.
Yep, go ahead.
3, 2, 1. Okay, let's move on. The NBA season is underway in Orlando. Max 7 games each day, played on 3 different courts. And Dr. Cole, it sounds like the NBA is doing things right. They have the teams in a bubble, and unlike Major League Baseball, they put together a great program. I know MLB is doing their best, but it seems like that things are going very well in Orlando, and we're going to bring on the NBA Director of Sports Medicine now, Dr. John DiFiori, who spent nearly 3 weeks in Orlando. And Dr. DiFiori, thanks so much for joining us. Can you tell us how the NBA was able to put together such a complex bubble atmosphere that seems to be working right now?
Well, thanks. It's great to be on the show with you and Dr. Cole. It really required an awful lot of work over the course of the last several months, and it was done in very close collaboration with our colleagues at the Players Association. We all utilized a number of expert consultants in infectious disease and epidemiology, and created a protocol that is very, as you point out, is very detailed, very lengthy. But we feel it gives us a good chance to have a successful restart and hopefully a successful completion of the season.
Yeah, I would say, Steve, this has been an unusual setup. When you look at what you're implying, when you look at MLB and you look at the NFL, upcoming NFL, and then what NHL is doing, they've accomplished a pretty unique situation that I don't know if anyone's going to be able to duplicate. I think I can tell you that the league, I've been fairly involved with the Physician Society and the research group and so forth, and the NBA. John's on the NBA side, but he's also a sports specialist and has been really involved with all of us. We probably had, John, I don't know how many memos we had, but we could have had could have been 50 to 60 correspondences with very long, lengthy, detailed memos, and it's one of those things that it required so much patience because every week we had different information. And having worked with a variety of organizations, I guess I can't compliment them enough. John, I know you have your day job, and I'm curious how you balance it because it seems like you would basically be full-time with NBA things, and I don't know how you manage your patients. He's at Special Surgery where I train, Steve, which is an amazing institution. And I'm just curious how you've been able to manage it because I feel like I have 4 jobs, and and the easiest thing I have is doing surgery and seeing patients. The hardest thing is this, and I'm curious, how you've been able to balance it, and do you feel in any ways, and you never want to get complacent, but do you feel like you can kind of take a deep breath now where we're at least you see that it's working for the time being?
Well, there's a lot of questions in that one set of comments there, Brian, but thank you for those comments. I would say, first of all, today at noon, we released our 98th memo, 9/8, since March 11th. And there's constant monitoring and review and incorporation of new developments. Some of the memos that have been sent out are updates of previous memos, and I can talk more about that. But it's been quite a journey. It has been an incredible amount of work by really a huge number of people, and I'm a small part of that. But yes, it's been quite a balance of trying to maintain our, work. And of course, here in New York, particularly in March and April, we were overwhelmed with the COVID-19 cases in the city. And so that was a significant effort in and of itself. And at the same time, we began to look at ways that the league could potentially resume the season. And It was a 7-day-a-week operation by everyone involved. A lot of long hours, a lot of late nights, a lot of early mornings, and at the same time, maintaining my work at HSS was incredibly important. I was able to, with the support of HSS, devote the first 3 weeks essentially of July to being on site in Orlando, and have to thank our CEO, Lou Shapiro, and our physician chief, Dr. Brian Kelly, for providing me the opportunity to be on site and support the NBA in this effort. I will say that to your question about where we are right now, with the first games now underway, it certainly marks a milestone in this effort. But we know that it's taken an awful lot of work. It's taken great cooperation from the Players Association and tremendous participation from all the players and all the coaches who are in Orlando, who are really taking to heart the prevention measures that we've implemented in Orlando, and they've done a fantastic job. We know that it's got us to this point, and that we simply can't get complacent and let our guard down. It's a tremendous challenge with this virus, and we're taking it day by day and constantly monitoring and reevaluating and incorporating the data that we are gathering to learn from that and to inform our strategies and the new scientific developments that are ongoing. So things are evolving, and we're not simply reflecting back on what we've done. We're looking forward and trying to be proactive in any way that we possibly can.
Again, we're visiting with Dr. John DiFiori, NBA Director of Sports Medicine. I'm Steve Cashel with Dr. Brian Cole at Sports Medicine Weekly on this Sunday morning, only on The Score. Dr. DiFiori, take us through some of the measures that you mentioned that you guys did implement. I understand each day players, coaches, staff, reporters complete a symptom questionnaire detailing any ailments. Is that through the NBA's My Health app that each of these individuals is set up with?
Yeah, that's absolutely right. So we've been able to work with different aspects of what we do with the NBA in terms of technology and relationships with research. And again, with experts in infectious disease, we've established sort of a daily routine, if you will, where each person on campus completes through the NBA My Health a symptom questionnaire. Every day everyone takes their temperature and records that. And we also measure what's called pulse ox, or an oxygenation level, and all that gets loaded into the app, and that gets centrally received and accumulated. And everyone on the campus wears kind of like a little wristband, and it enables us to help everyone monitor their status with the daily intake. Such that when someone is moving about the campus, there are certain little areas where you touch your band to a sensor, and it lights up green if everything's been completed and everything's good, and it lights up blue if you've done everything but maybe forgot to put it into the app, or if there's a question mark about something that was entered. So these are just little checks and balances that we have, and everyone has been just fantastic about recording this information every day.
Would you say that the mainstay, though, of the success is the fact that it's a closed system? You know who's coming and going. There's that level of discipline. You're probably all still physically distancing despite having negative tests. And then also the fact that they've been able to get tested, in some degree of frequency.
Right. Right.
Is that pretty much what you would, if you say, look, if I had to pick a scenario, this is what's kept this thing going, is sort of those factors?
Yeah, I think you hit on all the really key points there, Brian. I would say the foundation of this and the reason that we're able to restart the season was the testing. We've established a daily testing program. Everyone on the campus gets tested every day for the virus. And because of that, it gives us an opportunity to play basketball. And the reason I say that is we know that it takes about 24 hours to detect a virus in someone who's been infected. And the good news is it may take up to another 48 hours before that person can then transmit the virus to someone else. So by testing every day, we're able to identify someone hopefully before they can transmit it to someone else. So that really is foundational. And through our consultations with our experts and through our laboratory setup at each of the hotels that the players are staying and the staff are staying, we're able to, really have a comprehensive testing program. We review the results constantly, and we're learning from the results every day and every week. And we're able to modify our approaches and our protocols based upon what we learn. But without that, without being able to test every day, it would be very difficult to play the sport of basketball, which requires, close physical contact without a mask. That being said, use of masks on a daily basis in every, situation, and physical distancing and hand washing. We have, throughout all of the facilities, there are kiosks and posters and hand sanitation kiosks that are set up everywhere, and as sort of just an ongoing reminder that we all have a responsibility on the campus to do our best to, prevent spread of a virus if it can get into the campus. And certainly the fact that it's a relatively closed system is really helpful in that regard. However, it's not entirely closed. I mean, we do have, support staff from Disney and transportation services that, live in the communities. They live at home, and they've been also very attentive to, the specific infection control measures that our consultants and experts have recommended.
Okay, great stuff. Dr. John DiFiori, NBA Director of Sports Medicine, talking about the NBA playing in their bubble situation down in Orlando. Dr. DiFiori, thanks so much for joining us. Continued success with your practice in the NBA. Appreciate the insight.
My pleasure, and we'll look forward to continuing, hopefully, and completing the season.
Let's hope so. Sounds great. Well, we're going to take a break here on Sports Medicine Weekly. When we return, Dr. Cole and I will be back with our Ask the Doctor segment. Stay with us at Sports Medicine Weekly, only on
670 The Score.